Okay, we are at 12:50 on the dot, so I think we'll get started now. Um, Welcome to everybody who's here to learn about strengthening family first prevention services, why CalWORKs is a core component of prevention. I'm going to tell you my goal today is to convince those of you who are doing comprehensive prevention planning that if you don't have CalWORKs as part of your planning team, you are making a big mistake. And hopefully by the end of this workshop, you'll understand why you should have CalWORKs as part of your team. So um, with that, I'm going to introduce myself. I'm Stuart Oppenheim. I'm a Director Emeritus at CFPIC, and I'm joined today by our two other presenters. So I'm going to let Andrea and Jennifer introduce yourselves, and then we'll get started. Andrea.
Good morning. Thank you for joining our workshop today. I am Andrea Lewis, Child and Family Policy Institute of California Linkages, Senior Program Associate, and I'm excited to be here with you all. Jennifer?
Thanks, Andrea. Hey, everyone. I am the Linkages Program Director at CFPIC and happy to be here and see all of you.
Okay, so what are we going to talk about today? First of all, CalWORKs and Tribal TANF are prevention strategies. They are a primary strategy for strengthening families and reducing maltreatment risk. Our Linkages program is a bridge that connects CalWORKs and child welfare across the prevention continuum. And why is it important now? Because of the alignment and timeliness of these activities. Hopefully, all or most of you are involved in California Prevention Plan implementation. So that's going on. There's a convergence of activities between that, the prevention array development, deployment in California counties, and the transforming CalWORKs efforts, which are focusing on equity and family economic stability. All of those are converging right now and providing a great opportunity for synergy across the various initiatives so that they build on one another and all achieve a common objective of preventing child maltreatment and supporting families and communities in preventing child maltreatment. So with that, I think we'll go to the next slide. Today we'll talk a little bit about how CalWORKs and TANF are an effective child maltreatment prevention strategy. We'll talk about the linkages model and its demonstrated impact on reducing child maltreatment. We'll focus on CalWORKs child-only families as a population that has great promise for us focusing attention so that we can support families and further decrease maltreatment. And then we're going to spend some time together in breakout groups talking about developing strategies to integrate CalWORKs and linkages into your local family first prevention services plans to strengthen cross-system collaboration, to improve family stability, and reduce foster care involvement. So we think it's an exciting workshop. We're going to cover a lot of ground. And again, at the end, I hope you'll all agree with us that CalWORKs and linkages needs to be a part of your comprehensive prevention planning. So let's go to the next slide. So we want to begin by emphasizing, underscoring, proclaiming, putting a big exclamation mark on the fact that cash assistance programs like CalWORKs and Tribal TANF are linked to reduce child welfare involvement. As you all work on your family first prevention services, CalWORKs needs to be one of the strongest partners, and we'll talk about some evidence that supports our belief that this is what you should be doing if you're not already doing it. So let's go to the next slide. So first of all, we know in our personal lives, money does matter. It matters to all of us. But in this context, the access to cash assistance is linked to reduced child welfare involvement. The Center on Budget and Policy Priorities found that state TANF policies that increased cash benefits and access are associated with lower rates of child maltreatment and foster care entities. They cite, for example, that $100 in monthly TANF benefits was linked to fewer reports of physical maltreatment and reduced foster care placements in studies that they did. So policies that increase cash benefits and improve service access are definitely associated with lower rates of child maltreatment, fewer foster care entries. They also reviewed that mothers participating in TANF who are eligible for full child support were about 10% less likely to have a screened-in maltreatment report compared with mothers eligible for only partial support. Greater access to CalWORKs and tribal TANF correlates with a lower risk of maltreatment reports. And economic supports in general reduce child welfare system involvement. There's been a California LAO, Legislative Analyst Office report. Report showed that increases in public benefits such as cash assistance are associated with declines in child maltreatment allegations, foster care placements, and child fatalities. And there are other evaluation efforts underway, one for the CalWORKs home visiting program, focusing on the reductions in child welfare rates and improved family well-being in the implementation of that program. And if you've been with our Linkages program forever, as we began Linkages in the year 2000, we articulated the mantra that California's best prevention efforts are its public assistance support programs. That if you want to do prevention, you need to focus on and strengthen those public supports. So money matters, we know that. And on our next slide, we're going to say that services matter. Families frequently experience overlapping challenges of homelessness, housing instability, untreated behavioral health or substance abuse needs, domestic violence or unsafe relationships, social isolation, and lack of informal supports. So California's welfare to work programs focus on removing barriers such as the need for childcare, transportation, and housing, in addition to work support activities such as work experience, education, job readiness. They also provide mental health, substance abuse, and domestic violence assistance. So your CalWORKs programs provide the resolution to these challenges that are described here. They also provide health and wellness as well as basic needs supports. So chronic stress, unmet basic needs, limited support networks increase the likelihood of crisis-driven system involvement. These risk factors are often present well before a child welfare referral occurs. And if you've been to our Linkages convenings, a couple of years ago, we heard from Claire Anderson, who did a wonderful conversation for us about what she called economic shock, that families who lose employment and need to turn to the public assistance system are in shock. And that shock creates the crises that often lead to child maltreatment. So again, being able to have a system, a CalWORKs system that can intervene with families immediately as they experience that shock is the best, as it were, a shock absorber, a way of helping people mitigate that shock so that economic shock doesn't result in child maltreatment. So next slide, we're going to talk a little bit about the Transforming CalWORKs program. And I know I see folks here who are on our Linkages Prevention Early Intervention Committee that I know about Transforming CalWORKs, but all of you may not know that much about it. So Andrea is dropping into the chat a lot of resources that describe what Transforming CalWORKs is all about. But basically, it's a program that is updating the CalWORKs welfare to work system that we've had since 1997, that over the years has continued to provide those kinds of supports we talked about earlier, really focused on family stabilization, really helped to address as the causes of family and child maltreatment, family destabilization by stabilizing families in order to help them support their children, knowing that if families don't have those supports, the ability to meet their families' socioeconomic needs, that they don't have the ability to benefit from work supports. So um, our CalWORKs program has always focused on that, but it has not been as friendly and engaging a process as it might be. So in updating the program, we're promoting family stability and well-being at the core of the CalWORKs Welfare to Work program, um, helping to reduce the stressors that increase the risk of child maltreatment, and shifting towards a family-centered, strength-based program. So again, if you don't know about transforming CalWORKs, you should. And as you learn about it, it will underscore where I began today, which is if your CalWORKs folks, if your welfare to work folks are not part of your prevention efforts, you're missing a wonderful opportunity to bring that focus into your comprehensive prevention work. So, all of what I've been saying is on the next slide. Our bottom line. Higher household income is consistently linked to fewer neglect reports. And we've got research that shows that. Fewer neglect reports, fewer substantiated maltreatment allegations, lower rates of foster care entry. Families reported to child welfare are disproportionately affected by economic stressors. CalWORKs and tribal TANF are powerful prevention efforts. And efforts to transform CalWORKs will increase alignment with FFPS goals. So to sum up, the research that I've talked about shows that cash supports, housing assistance, Medi-Cal, food supports, family stabilization, reduce the risk of child maltreatment by addressing the underlying economic and environmental stressors that disproportionately affect families who are reported to child welfare. Increased household income and access to basic needs consistently correlate with reductions in neglect reports, fewer substantiated allegations, and lower rates of foster care entry. And we will sum up by saying CalWORKs functions as a powerful prevention program, not just an economic support. And I spent many years in child welfare, and we didn't really recognize that making sure that our families had access to those benefits really benefited our ability to help them reduce the risk of child maltreatment. So I think that kind of sums up what we want to talk about. We want to hear a bit from you. So we're going to ask you, and if you've been to any of our activities, you know that we love our Slidos. So we're going to give you the opportunity to answer a question in Slido. What opportunities do you see for CalWORKs or tribal TANF participation to reduce child maltreatment in your community? So you can use the QR code with your phone, or Andrea dropped a link in the chat that you can use to go to the poll and give us your ideas. Tell us what you are doing or what you think you might do to engage those programs in your community. And thank you for listening to my plea for CalWORKs involvement in your comprehensive prevention planning. So, joint responses with child welfare, great opportunity. Connecting with benefits staff to identify if recipients could join prevention services. Please do that. Participation in the RED team. I think not everybody may know what the RED team is, but it's a sort of an upfront early engagement, multidisciplinary team process, getting them involved in, okay, this is what the family might be eligible to. So economic support, reducing family housing instability, connecting families to home visiting programs, definitely a fabulous, oh, I think I'm losing, okay, connecting clients to services before we get a referral, connecting with all home visiting programs, seeing CalWORKs and tribal TANF, we're getting a lot here. So Santa Barbara has a strong linkages program. Helping deliver concrete supports, definitely a very important factor. Stronger collaboration, collaboration in CFT meetings, mutually providing services to the mutual customers, definitely. Somebody's got their finger on the linkages pulse. So cross-training, I think that's critical for people in both programs to understand. Liaisons in schools, supporting families to feel more secure, linkages with behavioral health for family support. Definitely, this multidisciplinary approach is so important. And then we're seeing some stuff in the chat, which is great. Broader services for the family relative to maintaining family unit and services to support reunification. Excellent. More community support, definitely. You want to make sure that everybody in the community brings these services together. And we got one more person typing, so that may be where we want to go. I think it's time to, well, yeah, more. I think we're good with that. And yeah, let's move on and talk about linkages, which we've made reference to, but linkages is often what brings us together. So I'm going to turn it over to Jennifer, who's going to tell us all about the linkages program.
Thanks so much, Stuart. Yeah, so we're going to shift now into the role that linkages can play in this work, because I think as we've been talking about, service coordination models like linkages are linked to reductions in child welfare involvement. So wanting to start off talking a little bit about why coordination matters. I'll be sharing some information. We had an evaluation done of the Linkages 2.0 program, and this recent evaluation really showed the impact of linkages. And families who received coordinated CalWORKs and child welfare support experienced fewer subsequent maltreatment allegations and substantiations than comparable families who weren't served through linkages. And these findings also highlight meaningful improvements in how families engage with services. Linkages participants had stronger access to stabilizing resources, more unified and intentional case planning, and higher follow-through with recommended supports, which all contribute to increased safety and healthier family functioning. And so together, these outcomes reinforce a compelling message. Integrated CalWORKs child welfare engagement is not only beneficial, it's preventative. And as Stuart started, this is going to be a running theme. And the linkages approach really aligns directly with the FFPS goals, and demonstrates the value of cross-system collaboration in strengthening families. So just to kind of give an overview of some of the linkages evaluations findings, the evaluation showed that once families began coordinated case planning through the linkages approach, they experienced fewer unfounded and substantiated child maltreatment referrals than before. There were 2 counties involved, and across both of these counties, the most consistent elements of this coordination were the sharing of family needs and the joint recommendation of CalWORKs and child welfare services, even with differences in local implementation between the 2 counties. And I think in the Slido we just did, a lot of you talked about some of this stuff. Early communication about family needs appears especially supportive of CalWORKs participation, while deeper collaboration between CalWORKs and child welfare staff seems to play an important role in helping families move toward reunification. Families who were involved in both systems also reported that coordinated case planning made it easier to understand and complete their program requirements. And throughout the process, workers consistently provided referrals and helped families across accessing stabilizing resources, reinforcing the value of a unified approach to meeting family needs. All right, so let's talk about the improved outcomes. Once families began coordinated case planning through the linkages approach, they experienced fewer unfounded and substantiated child maltreatment referrals than before. We're really trying to drive home this point. At the same time, the findings make clear that participation and reunification outcomes were not consistent across both counties, underscoring the need for additional research. So the two counties demonstrated notable differences. In County A, for example, sharing family needs within 10 days of identifying a family as eligible for linkages was associated with 2.2 additional months of continuous CalWORKs engagement compared to slower information sharing. County A also saw a modest increase in CalWORKs participation, about 1.1 months, when there was some level of collaboration and joint monitoring activities. And the same collaboration was linked to significantly higher reunification rates in County A, with outcomes 22% higher than cases with no collaboration. So together, these findings really highlight both the promise of coordinated case planning and the importance of understanding how local implementation shapes the results.
Jen, I just want to note that Andrea dropped a link to the whole evaluation report in the chat for folks interested in taking a look at it.
Thank you so much, Melissa. I just missed that part. So thank you. Thanks, Andrea. And yes, please take a look at the evaluation, results. It has a lot of really good information in there. Moving, as you've heard me say a few times about reduced child maltreatment, the reduction in substantiated referrals is a little bit more complex to interpret. And the evaluation points to factors that can help explain this. And we know with prior research, it's been shown that when families receive services that closely match their needs, they're less likely to experience new maltreatment reports or substantiated re-reports. So similarly, higher levels of family engagement have been linked to reduced risk of both maltreatment re-reports and substantiated re-reports. So these findings suggest that the quality of engagement and alignment between services and family needs play an important role in shaping outcomes, adding important context to the linkages evaluation results. So the impact on CalWORKs and child welfare outcomes. The evaluation highlights how specific collaboration practices relate to the stronger outcomes for families. This is another running theme. Even some level of collaboration in joint monitoring activities, as we talked about earlier, between the counties, was, seen with a higher percentage of cases that didn't have collaboration. Just highlighting the point of early information sharing is really critical of a family being identified as eligible for linkages. And that leads to them being, engaged in CalWORKs longer and more successful supports for families to move through the system. All right, improved access to resources. Although some of the county case review data in the evaluation suggests that most families received between 1 and 5 services, the service recipient survey that was done paints a fuller picture of the breadth of support families accessed through linkages. So survey respondents reported receiving numerous resources tied to basic needs, such as income support, housing, food, and transportation, which often, as we know, relate to general neglect concerns. And 3/4 of the respondents entered Linkages 2.0 with more than one unmet need, most commonly financial assistance, followed by food and housing stability, and then behavioral health services. And families also reported being offered multiple resources while in the program. And nearly all who were offered the services used them, actually 40 out of 44. And among the 44 respondents to the participant survey, stated the most frequently offered supports included CalFresh, income-related assistance such as utility or general aid, transportation help, mental health or substance use services, and then housing resources. So together, the findings highlight the significant and varied needs families bring to linkages and the program's role in connecting them to essential stabilizing supports based on their family needs. So for the Linkages 2.0 evaluation conclusion, it is a promising model for preventing maltreatment and promoting family stability for those mutually involved families. So Linkages works in prevention. And then just to wrap up the evaluation a little bit, several key processes and structural supports strengthen the implementation of coordinated case planning within linkages, and many of these elements are applicable to other cross-system coordination efforts. Centralized data access, specifically the ability for workers to view family enrollment information across CalWORKs and child welfare, can help staff identify mutual families more quickly, as we talked about, which is really helpful, and track changes in the family circumstances throughout the month, which can allow for more responsive service delivery. Establishing a designated role for identifying mutual families also promotes consistency and timeliness, which can reduce the reliance on individual workers' knowledge or on families to self-disclose their involvement in both systems. Co-location enhances coordination by embedding CalWORKs and child welfare staff in shared spaces, increasing awareness of linkages and facilitating quick problem solving, and really supporting real-time information sharing about family needs and available resources. Integrated structures for joint case planning, such as dedicated venues for team decision-making meetings. You guys mentioned in your Slido that, involvement with CFTs, can create predictable opportunities for staff, to be individual champions. Leadership commitment is critical to the linkages program, ongoing training, making sure both sides, of the house really know what each other is doing, and intentional communication throughout all of these efforts really help sustain the model. And so together, these supports create the conditions necessary for consistent, high quality coordination for families. And now I'm going to shift to Andrea.
Thank you, Jennifer and Stuart. We've heard about CalWORKs, Welfare to Work, transforming CalWORKs, linkages, and the evaluation that said, this works. Now let's focus on this one population so that we can have a whole family-centered approach. I'm going to go ahead and drop in the chat our child-only webinar that we had in February. Please copy this link, share this link, and view it at your own convenience. As we've seen, cash assistance programs, including CalWORKs and Tribal TANF, are consistently associated with reduced child welfare involvement, especially when families receive stable, adequate support. Similarly, service coordination models like linkages strengthen family stability and are also linked to lower rates of child maltreatment system contact. Child welfare system contact. Now we turn our attention to a group that often falls through the cracks, CalWORKs child-only families. These households face heightened vulnerability. Yes, they receive significantly fewer supports than other CalWORKs families. This gap matters because it places children at greater risk despite the evidence that robust assistance and coordinated services can reduce system involvement. According to the LAO, about 55% of CalWORKs families include no adult recipients, meaning parents are excluded from aid due to immigration status, SSI receipt, time limit exhaustion, or other eligibility rules. These families do not receive family stabilization or welfare to work services, even though they often face intense economic and caregiving stress. Exemption from participation requirements does not mean low needs. In fact, it often reflects complex circumstances that increase risk. Some families were assessed and received services early on, but many, especially those affected by immigration exclusions, non-needy caregiver status, or SSI-linked ineligibility, are often not assessed at all, despite significant barriers to stability. As a result, roughly half of families receive neither grants nor work-related services, even though they remain visible to systems and vulnerable to child welfare involvement. Key drivers of ineligibility and exemptions: immigration status, parents excluded due to unauthorized access; caregiver status, non-needy relatives caring for eligible children; SSI receipt, parents receiving SSI are excluded from CalWORKs; sanctions, adults sanctioned for noncompliance with welfare to work rules; and time limits, adults timed out after 60 months of aid. Next slide. Thank you. Public systems, including CalWORKs, are primarily structured around eligibility determination and program compliance, not early identification of family stressors or prevention needs. In CalWORKs child-only cases, where there are no welfare to work participation requirements, there are few structured opportunities to understand what caregivers are facing or to connect them with stabilizing supports. Staff often lack the tools, time, or program pathways to engage caregivers in deeper prevention-focused conversations beyond the immediate task of processing eligibility. As a result, many child-only families move through or exit the system without any connection to preventative community-based supports that could strengthen stability and reduce future risk. Child-only families often navigate both CalWORKs and the child welfare system, yet neither system fully meets their needs. In CalWORKs, caregivers frequently receive no aid, lack access to welfare to work or stabilization services, and remain largely invisible in policy. In child welfare, child-only households face complex needs, higher risk, and unstable caregiving arrangements that often go unsupported. Across both systems, families experience poverty, trauma, caregiver stress, limited access to services, and fragmented siloed supports. These families live in both worlds, but they fall through the cracks of both systems, missing critical opportunities for prevention and stability. Next slide. Thank you. The experiences of many child-only families reflect the repeated systems loop. And as you see here, they go through the economic hardship, then there are child-only case, then family instability, and then child welfare involvement. And it's a loop. The experiences of many child-only families reflect a repeating systems loop. Economic hardship increases the likelihood of becoming a child-only case, which can contribute to family instability and elevate the risk of child welfare involvement. Once families enter this cycle, it becomes harder to exit, and the loop reinforces the racial disproportionality we see across both CalWORKs and child welfare. This cycle is not driven by individual choices. It is the result of structural inequities that that shape access to resources, stability, and support. Breaking the loop requires prevention strategies that interrupt these patterns early, especially for families most affected by poverty and system involvement. CalWORKs child-only cases include families who are connected to the system through their children, yet often have limited ongoing engagement with CalWORK services. With fewer required activities, such as welfare to work, these families may receive benefits without any broader needs assessment or supportive conversations. This creates a gap, but also a clear opportunity. Families are already known to the system and receiving aid, yet many are not connected to community-based prevention services that could strengthen stability. Child-only cases present an early access point where outreach can occur before stress escalates or child welfare involvement becomes necessary. Voluntary strength-based outreach can help connect caregivers to supports that promote family stability, caregiver well-being, and child safety. So, let's share your ideas. How can communities reach child-only families to engage in prevention services? We're going to pull the Slido up again. I'm going to drop the question in the chat just in case. And then I'm also going to drop the link in the chat in case someone lost it and needs it back. And let's talk about it. I see someone typing. How could communities reach child-only families to engage in prevention services? How can we do that? Screening and outreach. I like the word screening and outreach. We have an opportunity to communicate with them. So that screening piece and then that outreach piece is excellent. The CalWORKs worker could provide information to a family about community resources, assessments, outreach to CBOs and schools, use trusted staff to introduce services. Sharing information is huge. Triaging. Oh, you guys are moving fast. Thank you. Flyers, mailers, outreach to CalWORKs clients about community services. I love that. No matter if they're receiving services or not, let's send it out to our community just in case they do need some services we don't know about. I love that. Meet the families where they feel safe to receive information. Identify within the CalWORKs system, but then provide resources to community partners. Right, because they're not receiving services from us, so who are they going to? Those community partners. Connecting with and collaborating and communicating with your community partners is so beneficial for the families we serve. At enrollment in CalWORKs benefits, a referral is made. If there are specific early, I lost it. You guys are fast. I love it. Connection to services like relative caregiver support to then access more services that way. Going directly to different populations, tribes, community centers, libraries. Educating staff on legal remedies to identify if a client can be referred to legal services for immigration support. Oh, I see someone put some comments in the chat. Churches, community centers, yes. Outreach about disability systems. California Children's Services and Regional Center. Training the Department of Public Social Services, Health and Human Services teams of available services. Interpret policy different. Thank you for that. Thank you all for your participation. I am now going to go ahead and transition back to Jennifer, and we'll talk some strategy.
All right, thanks, Andrea. All right, so now you've heard Stuart share evidence showing CalWORKs and TANF as effective child maltreatment prevention strategies. Then I talked through the linkages model and its demonstrated impact on reducing maltreatment. And then we just heard Andrea talk about the unique needs of CalWORKs child-only cases and strategies to better support them with prevention. And so now we want you guys to be able to have an opportunity to talk to each other about strategy. So in a moment, Melissa will do her magic behind the scenes and offer 3 different breakouts. And we'll have an opportunity to have 15 minutes in each, or 15 minutes in these breakouts. And you get to choose where you go. Stuart will be hosting the first one around engaging CalWORKs and tribal TANF in FFPS. I will be in the second one around linkages, and then Andrea will be in the third one around child only. And there's some guiding questions for you guys to think about and talk about. Why is this important in your community? What can you do to change policy, practice, or partnership to make it happen? Who needs to be at the table? And really thinking about what would success look like.
And I think we're a little bit ahead of time, Jen, so I think we'll expand the breakouts to 20 minutes. And I'll give you guys a warning before I close the rooms, but I'm going to open them now.
Right.
And you should be able to select where you want to go. But shout out if it's not working correctly, and I'll put you where you'd like to go. Oops. For those who haven't joined a breakout room, I'm just gonna assign you. But feel free to come back to the main room if I sent you somewhere where you did not want to be. Welcome back, everybody. We'll, I see people are still leaving their breakout rooms, so we'll give them just a minute to rejoin.
Sorry, I couldn't get off mute. Welcome back, everyone. I hope everyone had a great time in their breakouts and had some good conversation. I know we did. So I think I will start, Stuart, with your breakout group first.
Okay, well, I failed miserably at A, getting anybody to report out, and B, even finishing all the questions. But I'll go ahead and share a couple of things. One, we did hear that there are some counties that really do some great work in engaging CalWORKs income supports in their prevention programs. So we've got some successes already there. And somebody very much liked the idea of getting CalWORKs onto the red team. So that's something we heard earlier that was something that seems like a great strategy. So a good next step, I suppose, would be that. A county's really looking at, do you have those red teams, those early MDTs, and do you have CalWORKs there, or should you have CalWORKs there? So, and then key strategies and implementation challenges. I'm going to speak for the group. We had the same answer to both, which is tribal engagement. We had some conversation about tribal engagement. We encourage folks who want to know more about tribal engagement to come to reach out to you, Jennifer, to hear about the work that Linkages is doing around tribal engagement. So hopefully you'll be getting some emails from folks who would like a little bit more, to know a little bit more about what Linkage is doing around tribal engagement. So it's a key strategy, but also an implementation challenge. And we have somebody on our group from Office of Tribal Affairs who said, if counties are having a hard time engaging with tribes, that they are a resource that people can reach out to. So it's the California Department of Social Services Office of Tribal Engagement. So again, mea culpa, was not the most successful breakout, but we did have a lot of good conversation and some great participation.
That's great. Thank you, Stuart. All right. So I had a little bit better luck. I think I just maybe begged and pleaded. And so Stacy agreed to be our reporter outer for the Linkages breakout. I hope you got my email by now, Stacy. I'm not sure, but I'll turn it to you to share.
But I'll do the best I can. We were, talking about the importance of prevention. We talked about a lot of things, and now I'm trying to remember what all of those things were. I know, like, I talked about getting like other agencies involved, like other populations. Some of the benefits of prevention is, Linkages is great at connecting CalWORKs and child welfare involved families, but there's other populations that will or could eventually become child welfare involved. And so prevention really gives us the opportunity to expand the reach of who we're serving. We talked about other agencies being involved. We talked about probation. Sorry, my memory is just now. I was like trying to really read it really fast before we jumped out of that room, and it's all just blending together. Yeah, and I still haven't gotten that email, Jennifer. I don't know.
I know I started to think about the issues we have in that, but yeah, I mean, I think, talking about the partners to have at the table, go beyond just that, right? When you're looking at larger systems, education is important when you think about community and prevention and all of those things. And so I think that was a conversation that we had. And I think we didn't necessarily talk about this as an implementation challenge, but I think what we talked about was, as we know, it's really important to have leadership buy-in, and leadership at the table and support, and thinking about making sure that each of the systems know what each other is doing, right? And then having some of that built-in policy and practice, to make sure that things can sort of sustain as we move forward. All right. Okay. Thanks, Stacy. I appreciate you partnering with me. No, you're good. All right, Andrea, I will pass it to you for the child only breakout.
Oh, I think I did so good. Miss Aleda?
Yes, thank you. So we discussed providing prevention services and supports to child-only families, right? So the first question was on why this work was important, right? And we discussed that, it's very critical that we just not focus on CalWORKs families really, but all of our families in our community, right? Because we want them all to have the opportunity to really thrive and really being able to provide that prevention framework so they don't go into the child welfare system. We talked about who needs to be at the table, right? And of course, it's CalWORKs, Linkages, right? Our child welfare partners are those partners that are providing those critical services, right? Like behavioral health, domestic violence, our substance use partners, our FRCs, our colleges, adult schools, our just our school system overall, our childcare, right? Partners, and as well as our workforce partners, right? In making sure that they understand the supports that are needed in order for our families to go back into the workforce. We talked about what can we do to change policy practice and or partnerships to make this happen. Some of us shared that we just need stronger connections, right? Connections, again, within, whether it be interagencies or community partners, our centers, as well as our community, our families, right? Because we want to have that client voice, that client experience, in our decision making. And I think I already covered the who needs to be at the table. We covered a lot of the same and multiple questions. And then the last one here was on what success would look like, right? And so that would be, families being seen, families being supported, and we have less families going into the child welfare system, more families thriving in our community where we were able to remove those barriers and stabilize the families. Where there was no wrong door policy, right? Where all of us are fully aware of the resources and supports in our community so we can really connect our families.
Oh, Aleda, you did so good. I was like, she's not going to be able to understand these notes. They were talking so fast, I could hardly keep up. So you did a really, really good job remembering and being able to read my notes. Talk about language barriers. I should spell things correctly if I want you to read them right. I do want to uplift the Coalition of Slavery and Human Trafficking. Angie talked about in the child-only population, we talk about immigration restrictions. And after April 1st, there will be populations that won't be eligible to CalFresh or Medi-Cal due to the federal changes in citizenship. Staff having awareness and being able to step in and provide services to this population. Is going to be important, right? Some challenges are being faced, are telling, right? No one's like really trauma informed about what's happening today. And we have the goal that we want this population to jump back into the workforce, but now we have fear and we have additional barriers that are there. So just being mindful of the families that we serve, and making sure that we're putting prevention in action across our communities as a whole. So thank you.
Thanks, Andrea. All right. Well, we're nearing the end. Thank you all for your participation in the breakouts. I think it's always really helpful for you guys to be able to hear from each other. And so I'm going to throw it to Stuart to close us out.
Well, Jen, I wanted to take a second and lift up a couple comments in the chat
Oh,
too.
yes. Okay.
just because they're great comments. And Yvonne from Napa County had shared about workers outstationed at elementary schools and the library, and really use those locations to share information with families. And apparently, they have a RV now that they have like a mobile office so they can go where the people are instead of making the people come to them, which I just think is so awesome. So I wanted to lift that up. And then Stacy had shared an example of success from Maria in San Diego that their vision of success is families experiencing CalWORKs as a family strengthening partner, where they can get housing, income, and childcare support with smooth, warm handoffs from CalWORKs and Tribal TANF to family resource centers, home visiting, and other supports. And of course, over time, there would be reduced involvement of the child welfare system, especially in overrepresented communities. So I thought those were wonderful comments. I wanted to make sure folks saw them in the chat. Now to Stuart. Sorry, Stuart.
No, that's okay. And actually, it's a good reminder. When I went back and looked at the chat in my group, we had a lot of good input. So in the note, so I'm copying and pasting that into the notes. So when we have
Great.
you'll have the information to share with folks. So a lot of good examples, a lot of good engagement. And then the one comment that Stacy put back in the chat for everybody, which is that it's all about engaging as many people as possible in your planning and really having an open mind to how expanding as much as you can. So, and then somebody in the chat talked again about how important it is to include CalWORKs in that prevention planning in the MOU. So it's not a required partner, but it's a desired partner. So anyway, back to our key takeaways. So CalWORKs and Tribal TANF are proven prevention tools. Linkages strengthens impacts throughout coordination. Child-only cases represent a vulnerable population and a great prevention opportunity. And family first prevention services are stronger when economic supports are central. We know, again, I'd like to go back to that slide that we had. Money matters. It matters to each of us. Every 2 weeks when we get our paycheck, if we're getting a paycheck, and if we're not, that's something of significance also. So anyway, just remembering that as you're doing prevention, um, it's just an important thing to think about. So we have one last Slido, I think. We can't get out without another Slido. So again, you've got the QR code, and Andrea will drop the link in the chat. So how might you incorporate these learnings from today into your team meetings tomorrow? Because I think most of you are meeting as teams tomorrow. So hopefully we've given you a lot to think about and a lot to bring into those team meetings. So go ahead and tell us how you think you might take today's learnings and turn them into reality. A couple of people typing. You're going to have to read fast. But yeah, lots of people typing. So add linkages to the prevention plan, connect with CalWORKs partners. Yay. Thank you. Glad I've met my objective, discuss linkages process in the county, lift up linkages into our prevention plan. Andrea is smiling and smiling and smiling. Um, and if you're not a linkages county, reach out to Jennifer so that you can become one.
I definitely dropped our emails in the chat. I really do believe in the work that we do on a regular basis, but I really, really believe in the linkages philosophy. Remove the silos, collaborate, communicate. Like,
Go
it
linkages.
sounds like it's the easiest thing in the world, right? And it seems like it maybe not. And
Yeah.
so, yes, go forth, prevention and action, collaborate, communicate, remove
Yeah.
those silos. Somebody
Um,
said in our chat, they said, how many of us know another agency person by name for warm handoffs, right? Sorry to take over, Stuart. Back to your
That's
slide.
okay. No, no, I think that you're kind of echoing what we're seeing, which is again, reach out, connect, make those relationships, work on growing the collaboration between welfare to work and child welfare, continue to include CalWORKs eligibility, and making sure that people who are eligible for benefits get those benefits. I mean that we didn't mention that California has a pretty low uptake rate. The number of families, the percentage of families who are eligible for CalWORKs that actually apply for and get CalWORKs is pretty low. It should be 100%, and it's nowhere near 100%. The department is working on it, but you all can work on that in your communities as well. Let people know what benefits are available and get them to those benefits, for all the reasons we talked about earlier. Um, Again, grow that collaboration. So really great participation today, great conversation, wonderful group. I think hopefully you all have learned a lot. I think we've learned a lot from all of you, about what's going on in your communities. And hopefully, I mean, we're all about peer mentoring and peer sharing. So we're learning from you what we can share with others. So join our team, join our linkages team. And if you're, again, make sure that your comprehensive prevention planning, the state gave you some recommended partners, some mandatory partners, but that's not everybody in the universe. So look at your universe and see who could benefit from the services that you all provide. So anyway, I think unless our Andrea, Jennifer, Melissa, have we got anything to add? Um, Great to have you all here, and we will hopefully you'll have very productive meetings tomorrow. And again, you'll bring a lot of this learning to your meetings.
I just want to say thank you so much to Stuart, Andrea, and Jen for doing the presenting today. You guys did a great job, and I'm so grateful for everybody's participation.
And you help set us up for success.
And I
That's right.
just want to throw out there really quick, we're going to go ahead and have a break, and then you'll go back into your next workshop for session 2 at 2:25 p.m. Thank you.
Thank you.
Thanks, everyone.